repair case.
Good afternoon. I'm from Guangzhou Women and Children's Medical Center of Liuzhou Hospital. So I'd like to share with you my experience of endometrial repair cases after HIFU treatment. The patient, 40 years old, female, progressive dysmenorrhea for more than 10 months, diagnosed as enlargement of the uterus in other hospital. The external hospital B ultrasound found uterine enlargement. Recently, there are fertility requirements, and the uterus volume is 84 centimeters, and the myoma is 52, and there's a myoma. So the diagnosis is adenomyosis combined with uterine myoma, and we conducted HIFU treatment on this patient. And on March 2nd, 2021, the eradication time 450 seconds, treatment time 42 minutes, and the intensity 642, and the treatment dose 146,750, and the ablation rate is 100%, and the ablation rate for the uterine glandular muscle is 62%. 10 months after the MRI, and the uterine volume reduction rate is 49.5%. In 2022 April, on June 19, ultrasound was conducted, and we found that the uterine line was compressed and the local shape was irregular, and a hypoecho area with a range of about 38 plus 33 plus 21 millimeters, and we suspect it is a myoma in the uterine cavity. And the hysteroscopic surgery was performed on June 23 and 2022. There was a yellowish lesion in the uterine cavity, which was about 3.5 plus 2 centimeters in size. And according to the pathology, it's denatured necrotic tissue. After the treatment, there is bleeding in the vagina, and there is no return of menstruation half a year after operation. B ultrasound, we found that there is a hypoecho in the uterine fundus wall, and with scattered hyperecho calcification and thick endometrium in the middle and lower segment of the uterus. And this is a second hysteroscopic surgery, and we can see that the shape of the uterine cavity is abnormal. There are a lot of adhesive bands in the lower parts of the uterine cavity, and the adhesion area accounts for about 1/3 of the area of the uterine cavity. The middle and upper part of the uterine cavity and the bottom of the uterus are all hard scar tissue, and the intimal coverage rate accounts for about 10% of the uterine cavity area. So we have resected the adhesion, and the uterine has resumed to the normal shape. This is the fundus, the yellow without blood circle. 4 months after the operation, hysteroscopy and the balloon removal were performed. And the endometrium of each part of the remaining uterine cavity recovered well, and the medication was performed for the patients. Menstruation continues. And summary, it's diffuse focal. So in treating this kind of diffuse adenomyosis, we should pay attention to the protection, how to protect the endometrium, and the hormone medication should be carried out in time to promote the treatment efficacy. So I like to provide a poem for you from Poet by G.E. So, like the fire burns out the grasses. If there is despite the wildfire burning, the spring breeze still flourish. So, after HIFU treatment, we should rely on the self-recovery ability of our body and the treatment efficacy of HIFU. We can provide the optimal treatment or modality for our patient and to fulfill the fruits of our treatment. Thank you. That's all for my sharing.